San Diego 6 News in the morning. Your station for balanced news.
Also, migraines and strokes. Why one of these could actually lead to another. We will talk to a local neurologist about this.
Well, a very, very heavy debatation tonight. We had a very daring bite. Let's go to Terrace and look for the head of the pit.
Boy, it was a frightening video that was seen around the world. KCBS reporter Serene Branson appeared to have a mild stroke on live television, but later her doctors say that was actually a migraine. Dr. Jack Schim, a neurologist from the Neurology Center of Southern California, is here to explain exactly what happened to Serene and what were we seeing there. First of all, thank you for being here with us this morning, Dr. Schim. But what were we seeing there? What happened to Serene?
Well, she was having migraine aura, and that's a fairly uncommon kind of occurrence in the brain. It's an electrical change in the brain. When people have migraine, they experience pain in various nerve territories called the trigeminal nerve.
Is that basically the top of the skull, the top of the brain?
The trigeminal nerve is sensation over the whole face, over the forehead, the temples, and even indirectly part of the back of the head and the shoulders. When they have aura, there's a electrical change that shifts across the brain, and that correlates with the zigzag lines, the inability to speak, maybe numbness up or down an arm, paralysis perhaps, that is one of the first features in migraine. About 15% of people who have migraine have that. And
how quickly can that come on? I mean, you start to feel a headache, and then does that aura effect just happen all of a sudden?
Usually the aura happens first. Usually that comes on and may take 10 or 15 minutes up to maybe 40 minutes to clear, and then people get a severe headache with nausea, sensitive to even mild light, noise sensitive, sensitive to smells, perfumes.
My husband suffers from these types of migraines, and you can see the change in his face. Literally, he'll go pale, and his speech will be slurred, and he'll literally be almost blinded in one eye when this happens. So this is really serious, and it affects a lot of people in Southern California.
It does. You know, there are somewhere around at least 10% of the population has migraine. It affects 3 times as many women as men. So, for example, between age 20 and 40, close to 30% of women have migraine.
Are dealing with this.
Are dealing with this on anywhere from occasional to very frequent basis.
Let's talk about some of the remedies for this. There are medications you can take, both prescription-based and over-the-counter. And then we're also talking about how Botox is helping migraine sufferers. How is that working for people?
Well, Botox is used for people who have very frequent migraine as a preventive. We inject in various locations around the head, across the forehead, across the temples, the back of the head. And people get a series of injections, typically 31 to maybe as many as 39 injections every 3 months or so. And it blocks the pain impulses. It blocks these nerve impulses that would otherwise be part of the provocation of migraine. So it can take someone who has very frequent migraine, 20, 25, 30 days a month, very frequent migraine, and potentially take them down to 0 or 5 or 10 migraines.
So there is hope for migraine sufferers. What else are we looking at here on our table in front of us? What are some of these medications that people may consider taking?
Well, there are non-prescription preventives, so coenzyme Q10, riboflavin, which is B2, can be helpful. There are prescription medications that are used preventively. So, for example, we have an Alzheimer's type medicine that we use off-label for migraine as a preventive sometimes. Botox and the tiny syringe that we use to inject it. There are oral medicines that are prescription for knocking out an individual migraine. We talk about that as abortive or acute treatment. So tablets of different sorts, a powder that dissolves, actually even a self-injector. People can give an injection with a device that has no needle whatsoever and can give them relief in 20 or 30 minutes.
So there's certainly hope for this. Also, if you are suffering from migraines and you need some information, the Neurology Centers of Southern California, we have got their information right on our website. It's also, go to sandiego6.com if you don't have a chance to jot this down fast enough. The last question I had for you, doctor, is why are migraine sufferers at a greater risk of having a stroke, and how serious should they take that?
Well, that's a challenging question because the real answer is we don't know why they're at a higher risk. The actual risk in terms of the likelihood of someone having a stroke who has migraine, although it's increased, it's 2 times or even more increased, remains very low because most people who have migraine don't have other vascular risk factors, so they're generally otherwise healthy young women. But I think that people who focus in on keeping themselves healthy, managing their blood pressure, eating well, exercising regularly, they're going to have fewer migraines, and they're also going to have a lower risk of stroke.
Thank you so much for coming in this morning. We certainly appreciate all your information. Although it was tough to see what happened to Serene, it certainly brought this topic to the forefront and gotten us talking about it this morning. So thank you again for coming in, Doctor. We certainly appreciate it. Again, for all the information, just go to our website and hit Hot Topics.